So we already know that most of the gray matter of the brain consists of the cerebrum. And the cerebrum involves the frontal lobe, the parietal lobe, the temporal lobe. This will be the frontal lobe, this will be the parietal lobe, and these will be the temporal lobe. Then behind that and underneath will be the cerebellum, which controls the functions of coordination, fine coordination, muscle coordination, balance, gross motor skills. And then you have the part of the brain within the brain. So you have the deep part of the brain. This is called the corpus callosum. I think we remember that. Then you have the thalamus, which is underneath that here. And then the basement part of the thalamus will be called the hypothalamus. Let's just make that this right here, the green. What we're going to be focusing on most is the green, the hypothalamus, because that is what's innervated and connected to this little pea-shaped structure here called the pituitary gland. This is the pituitary gland. And the hormones that are secreted by this master gland control a lot of functions and has major effects on different organs of the body through the bloodstream. Now I said that this is innervated with the hypothalamus. So we have nerve endings that go into the hypothalamus and the thalamus. Now the hypothalamus controls your vital signs. So you have temperature, blood pressure regulation, heart rate, and respirations. So any injury to this or the brainstem, which is connected to these two structures that lead to the spinal cord, and then you have the pons here. The brainstem, if you have a brainstem injury that's has a very high mortality rate, chances are that an injury to this site of stroke, aneurysm, anything, any herniation, any pressure to this brainstem can cause death immediately. So, moving on. Pituitary gland. And when we say posterior pituitary gland and anterior pituitary gland, we're talking about the front, which would be anterior, and the back of the gland, which would be posterior. So, just to get an idea, here's the eyeball, here's the nose, here's the mouth. Let's draw a better mouth here. And the chin. So there you have it. Then you have the ear, the forehead, and I guess we can just draw some hair here. Just to, amplify this. This is the brain. Great picture, isn't it? Let's just draw a blue eyeball here. Okay, so that's an eyeball. So the pituitary gland is somewhere behind the nasal cavity, maxillary area, and tucked in underneath. Actually, when you do surgeries on the pituitary gland, they go through the nose most of the time to reach that gland, to relieve it of pressure, to get rid of a tumor, which are two major causes of what we're going to talk about today, SIADH. Two major causes are, one, it could be a tumor. Two, increased intracranial pressure. Trauma can cause increased intracranial pressure. Sinus infection can cause increased intracranial pressure. And these are the main things that can cause an elevation or a decrease or malfunction in the hormone that is secreted by the posterior portion of the pituitary gland, which will be the anti-diuretic hormone, ADH, anti-diuretic hormone. Now, the word itself tells you what this hormone does. Anti-diuretic. That means it's going against diuresis. It's going against the release of fluid. The release of fluid from the body is diuresing through urine. And we can give people medications to help them diurese, such as Lasix. Lasix promotes diuresis. Well, this has the opposite effect. Anti-diuretic hormone is against diuresing. It's to help keep your fluid in your intravascular space, to keep your fluid in your circulation. When I say intravascular space, I'm talking about the fluid that makes up your blood, the fluid that makes blood flow happen, perfusion happen. The blood that has components of water, plasma, and everything in it, that's intravascular fluid, that's intravascular contents, that's intravascular space. And this helps keep a blood pressure, this helps keep intravascular space volume so that you have a blood pressure, so that you have perfusion. So it's very important to have this hormone. However, too much of it can cause you to go to a fluid, too much of it can cause you to go to a fluid volume overload. We don't want that. That stresses the heart. It can cause a heart attack. Not only does it stress the heart out, but think about it. If you're increasing fluids in any kind of solution, let's say that you give yourself a lot of fluids and you're drinking and drinking and drinking and you're not peeing out, you're not going to the bathroom and you're retaining all the fluids, you're going to get edematous, you're going to be full of fluid, your lungs could fill up, it's very dangerous. It's hard on your kidneys, you can cause kidney damage, your heart's got to pump extra hard, it's going to be extra stress on your heart, you're going to be short of breath, and it's just not good for you. Also, you're diluting a lot of electrolytes. When you're increasing a solution and you have only a little bit of electrolytes in there to begin with, well, increasing a solution is going to dilute those electrolytes more. And the important electrolytes that we're going to talk about is potassium, sodium, and chloride. However, let's just talk about one and keep it simple. Or actually two. Let's talk about two. The two most important electrolytes that you have to keep track of when somebody has SIADH is, let's see if you can guess here. It's two of the big three that I just mentioned. Sodium, potassium. Okay? So let's draw a beaker here. A beaker is a container they use in science class in high school. It's pretty much just like a large glass cup, a large glass jar. Okay? Now let's say our fluid volume regularly, on a regular basis, would fill about this much of the beaker up. And let's say that all our electrolytes are right here. This is sodium, potassium, chloride, all your electrolytes are represented by these little particles here. Now this would be a normal ratio between fluid and electrolytes. Now with an increase in anti-diuretic hormone, you're going to increase your intravascular fluid. You're going to increase your fluid inside your circulation, which is going to cause a dilution of these electrolytes. So if you are not able to urinate and not able to release fluid appropriately because of an increase of the antidiuretic hormone in your blood, increase in antidiuretic hormone is telling your kidneys not to release fluid, so you're keeping your fluid in, you're going to build up fluid. And when you build up fluid to more than half of what it normally is, the ratio between electrolytes and fluids has caused a diminished amount of concentration of solutes, which will cause hyponatremia, hypocalcemia, hypokalemia. You're decreasing the electrolyte concentration, and that's dangerous. So just the normal amount of particles that you had has even become lower because you've increased your fluid volume. You have diluted yourself because you kept all your fluids in.